Hello, all you wonderful pet-loving guardians and pet parents out there. Thank you for being a part of our Pet Pain Relief Summit. I want to give a hand to you for all of your dedication and the fact that you're doing the best you can to get the most information to provide your animals there, your dogs and your cats, with wonderful lives. And certainly they appreciate all of this effort you put forth. So thank you for them, from them, and thank you from us for continuing to watch our summit. And this was day 4. I also want to give a shout out of thanks to the Pet Summit team, all the work they go through getting the hosts, the sponsors, they working with us, the hosts, to get presenters. You know, we have the folks that we enjoy and the ones that fit into the topic, and then they work to make it be the best it possibly can be, and all the background scene things that have to go on. So we really, really appreciate all of their work to bring this program, all of the summits, to all of you. And they're continuing to revamp and set out some plans for going forward. So it's going to be really, really, really exciting. And then also we want to definitely thank our sponsors. We have 3 sponsors for this Pet Pain Relief Summit. We have Polypats, Turmeric Life, and Yum Wolf. So we appreciate them immensely for helping to further these programs. So take some time, go on their websites and see what they got. And that's a gratitude from you for them helping sponsor the programs too. So we appreciate all that. So what did you think about day 4? Was that not fun too? Oh my gosh. So we started off with Dr. Katie Woodley talking about the problems with the pain associated with ear infections, and gave all kinds of little formulas that you can make to make homemade ear cleaning recipes. So you don't have to be spending money on those expensive products that have a lot of other stuff in it that you may not want to be putting in the dog's ear, and not always successful. So that one was really, really cool. And then Julianne Thorne came on and did her program with the cats and talked about colors and stones and different things for helping the kitties to have comfortable lives and help them get through pain moments. And then I had 2 interviews that I did with Dr. Barbara Royal. We talked about scenarios within the clinic of different pain situations and how she addresses those. And then Dr. Janet Gordon-Palm finished up our 4-day Pet Pain Relief Summit. And we were looking at, with her program, we talked about the situations of fear and stress and how that can augment pain, and some devices and her therapeutic approach that she utilizes. So it was just a whole lot of fun today, and I hope you enjoyed it as well. So that's going to complete our Pet Pain Summit, Pain Relief Summit, except for those of you who are interested in getting a little more information. There's the post-summit course where you'll be able to watch other presentations that I've done, and then we'll have some one-on-one conversation evenings where we go over questions and really address specifically problems that you're having, because you're going to have a questionnaire that you fill out, and I get that info and then we review that. So I'm looking forward to getting to know some others of you a little more closely as we go through that post-course program. So that'll be a whole lot of fun too. All righty, now we're up to the point of seeing what kind of questions we got from either today or any of the other prior 3 days of our Pet Pain Relief Summit. There we go, number 1. All righty, so it says, thank you so much. You're very, very welcome. She has a 2-year-old cat with chronic rhinitis. Oh, bummer. Yep, the calicivirus herpes as a kitten. Yep. How can I help his pain safely at home? Okay, so I suspect for them, you know, like, while it's probably not as painful as it is annoying, and I'm sure it's sometimes uncomfortable. So it's about trying to, so what happens then when they're really young and the turbinates, that honeycomb pattern of everything up in the sinuses, when those viruses come in there, the rhinoviruses, calices, the herpes, they get up in those terminates and then destroy the integrity of the terminates. And so now you no longer have this perfect, nice honeycomb pattern. It's irregular and jagged, and so we don't have that normal barrier anymore. And so these poor little guys, they end up with repeated bacterial infections and up and down, and you just think you're doing really good, and then something else happens. So I don't know that that's, like I said, as much of a painful situation as much as it is annoying and uncomfortable. One of the things that I've done with the cats that's helped, and I don't know if you're currently on that, but is using some nose drops. I would also look at ozone therapy for helping that, which will help with inflammation, which is going to help with pain. So I would look at that. And then looking at some of the homeopathic preparations for the cats. I try to, with the cats, go with more things that are like drops, something that's easy to get into them, that doesn't have a whole lot of flavor, rather than a lot of tablets or powders or things like that, that then you struggle to try to get in them because nobody wants to have to chase the cat around, and then they get to where they hide from you. And it's like they can tell even before you go to the closet or the cupboard or pick up the jar. They just somehow they know by how you look or how you move or something. It's like, oh no, it's that time of day. And so I don't know. Zoopharmacognosy, I have no idea with pica. So that's wanting to eat things. My deal is that when there's something out there, like if they're eating dirt and mulch and things like that in the environment, what they're trying to do is fulfill a nutrient paradigm that is not being provided to them. So anytime I have animals that are eating things outdoors that seems odd, or especially with a fetish where they really go to it, is that we need to figure out what's missing. And that goes back to doing the fur tissue mineral analysis test to find out what's deficient. Also, again, you get those heavy metals, and maybe that's a part of the problem too. So that's what I always is like. If it's pica, then let's find out what's missing. So maybe there is some other nutrients. And in the post course, there's a program that I did on the nutritional aspects of pain. I talk about how pain can be ramped up when there's not enough specific nutrients, because it takes specific nutrients in order for the endocrine system to make the hormones, and the hormones to break down the toxins, and to help support the body and to help healing, and then enough nutrition so that pain doesn't get set in, because it certainly can when all the tissue isn't supported nutritionally the way it needs to be. So I would look at that. I would look at ozone for him, about some nose drops and some homeopathic preparations. Thank you for that question. Our next one is a 16-year-old female golden retriever. Oh, the cyst on her tail burst yesterday. Yeah, yep. Okay, so I was talking about that last night or the night before, one of them, about the basset that had that great big cyst on his tail. And we used the neoplacine topical salve. Like I said, it's going to make a nasty wound, but otherwise what's going to happen is the cyst will heal, but you still have like this balloon sitting there of that capsule. And so it'll seal over and it'll heal across the top, but it's still in there. And using that neoplacine topical salve, it'll go in there and it dissolves all of that. And then, so it'll be nasty for a little bit. You have to wrap the tail up. But then all of that bad goes away. It's dissolved, it's disintegrated, and then use a salve that's a healing salve, and it all seals up. So yeah, those are bummers. And again, those kinds of cysts are about too much kapha. So if we look at Ayurveda, too much retention of things, holding on to things. Also want to look at lymphatics and get the circulation going, because a lot of times when they have one, then there'll be another one that comes up someplace and another one somewhere else. So that's what I would do in that regards. Thought panting due to osteoarthritis. Oh, so the dog had been panting before the cyst burst, and you were thinking it was the arthritis that was making her pant, but then it was the cyst. So that's what I would do. It works well. You just got to get through that dissolving stage, but after that, right. surgery isn't an option. One, because there's not enough skin there to do it with, and obviously at that age. I mean, I know with the Basset dog, they were talking about amputating the tail. Well, that's not good either. It might get rid of the cyst, but there's other ways to do it. So at any rate, I would do that. I still, at that age, the neoplacing would work just fine, which it's blood root. It's the plant blood root that goes after those kinds of cells. And then using your regular everything else for the osteoarthritis that you're doing, the rest of the pain support and things that you've learned. Once you get that cyst dissolved, like if you're using the blood root, the neoplacing, also then to help it heal up faster is you can use the low level laser. So if you have one of those at home, and if you have a pad and you're using it over like nasty ears or like on this kind of a wound, wrap it in saran wrap so that when you're laying it then over the wound, you're not getting your pad nasty. And you can just throw the saran wrap away, and the next day you put a new wrap on it, and you're always good to go. Alrighty, great. Thank you. All right, Nadine has a Sheltie that's 5. She's had her for 2.5 years, and she shakes her head. So I'm guessing we have been to different vets. They don't seem to be infected. Okay, so she shakes her head. So my questions would be, does she shake her head right before she goes outside? Does she shake her head when there's sirens running like down your street, like police cars or sirens? Does that make her shake her head? Does she shake her head when she gets excited, like it's food time, and then she starts shaking her head? I would look at, those would be questions I'd want to be asking. We want to find out, is it related to something in her daily life that triggers her? Like, is it a way she's just acting like she's happy, or is it something irritating her? So I would look at those. First off, there'd be questions like that I'd want to rule in, rule out. Then the other thing would be is that we're back to chiropractic. So there certainly can be subluxations in the neck or with the skull or with the TMJ that can affect the feelings there at the ears. So that would be my next thing is like, does she eat? Got help here. When she chews, is she eating it evenly? Like, is there something in her mouth when she plays? Will she pick up a toy and hold it the same in either side, or does she like hold things off to one side or another? It might be TMJ. So that would be another area that I would want to assess really quickly, is to have the TMJ check, the occiput, the atlas, look for some kind of subluxation, and then also looking to see the back teeth. Because if there was like maybe a molar or something that was irritating, that there might be times that hurt. And then she would be shaking her head for that reason. So it could be irritation. It could be just something annoying that bothers her, the sound of it. It could be just her way of showing she's excited. The other thing too, a Sheltie, sometimes they can get gnats or tats, if their fur gets kind of wound up. So my guess would be you keep her groomed, and so that's not a problem. But that would be another thing I'd think about too. I've seen them with those like tendrils and where they're dreadlocks and things from their fur getting wound around because that fur around their ears is so soft. So I would look at that too. So that'd be some things to think about on her and some options for you to rule in and rule out. Thank you, Nadine, for that question. See if we got somebody else here in the queue. All righty. A 3-year-old dog who's still lame, 5 months post elbow. MRI showed a bone infarct in the proximal ulna, so that's up closer to the elbow. So how do you know if it's from bone or soft tissue pain, and how do we treat the bone pain? So she's 3 years old. All righty. Okay, so several things that you could do. So one thing is to find out if it's soft tissue versus bone. Some of the things that like Dr. Edward talked about in doing soft massage, so working through the pain, and also that Laurie went through in some of her program, is that finding the tissue. So getting used to like, what does the tissue feel like? And are there areas like when you touch lightly, does the dog back off act like it's irritating, or does it take more pressure? And so if you touch the soft tissue and you're not finding anything, then you could touch the bone and see if the bone is sore itself. Sometimes the bone situations they actually grow out of, but those are usually when they're younger, when they get that, and panosteitis is what that's called when they're young. 5 months is a long time. So the other thing that I would want to know is the range of motion of that elbow back to normal? If it's not, if that elbow's range of motion is obstructed, then there's some more rehab that needs to be done. Because if the dog cannot extend the leg like they should, means it's always in a little bit of flexion, there is going to be some lameness because they can't make the leg length be the same as the other side. So there may be some of that that's factoring in here too. Then the other thing to treat the bone pain, so now we're looking at things that would be similar that you would do for cancer pain. So when we have like osteosarcomas, you would be looking at things like that to treat that pain. So alpha stem microcurrent therapy is one of the ones that I use and have for 23 years now. So that would be one of the things that's safe to put over that kind of tissue. Other things would be, you could also look at some of the ozone therapy. You could also look at some pulse signal therapy that could potentially be beneficial too. And then you may look at topicals that could be absorbed and maybe using a little bit of DMSO to help drive something in deeper to get through the bone. So those, but definitely getting some range of motion measurements so we know exactly, doing a gait analysis, making sure that sometimes when the elbow's involved with that, because elbow's a funky joint, that especially if they were bandaged or wrapped for a period of time and didn't use that extremity, then you can get a little bit of freezing that happens in that elbow, but also making sure that the soft tissue at the shoulder area is not part of the problem. So you have to get out of just focusing on the joint where the problem was and looking at the joints above and below, because oftentimes through that injury and the surgery, and especially if there wasn't a lot of rehab, that those joints above and below become restricted, compensating issues and problems. And that is where the problem is coming from, and maybe not the elbow at all, or the bone infarct, if that's the case. Alrighty, so that'll give you some ideas for starters there. Thank you. So we got another question in the queue already. All right, so we have an old, I'm guessing that's an old Shih Tzu, as soon as our question comes back. Oh, glaucoma. Okay, yes, glaucoma can be very painful. He can't have eyes extracted. Okay. Blueberries, turmeric, full spectrum hemp. Okay. Right. So is he on, I'm guessing that he's on eye drops too for the glaucoma to help with the angle. I mean, this can give him some like major headaches and pain in the eye. So what you want to do is help improve any kind of drainage. A Shih Tzu. Shih Tzus can tend to be a bit of a kapha dog too. So that means they're going to retain things. I would look at some of the herbs that are used, especially the different Ayurveda kapha. So I use banyanbotanicals.com, which is a human company. They're out of, I mean, basically they promote for people, but Ayurveda is Ayurveda. And these same herbs are used in animals and have been for thousands of years. But their products are organic. They're out of New Mexico in the United States. And their products are organic, and they have powders that come in small quantities that aren't generally very expensive. And so there's different ones that they have. If you look up kapha, and if you look up even eyes, if you look up, there's different herbs that help with the fluid. I talked about the mullein the other day, but there's some other herbs there on their site that are for helping to pull fluid. And so you can take that powder and add it to their food, or put it in a little bit of water and add it in. So I'd be looking at things like that to try to help whatever you can to get some of that fluid and get that pressure down out of the eye. All right, so that would be my starters, is to try to do something else to address the problem, the glaucoma, directly. And then, okay, what else could you do for the pain in the eye? Here's where I'd go to some of Dr. Blanco's homeopathic preparations that she talked about, using some of those to see if that wouldn't be helpful. The other thing is, back to the alpha stem, is where this product, it's used for healing. We've used it with people with glaucoma, and also with macular degeneration, and with corneal transplants and that. So you use the probes, the smart probes, and there's a treatment where you can do it just around the eyes. And so that would be another thing that I would be, if I had one that had the glaucoma, I would be recommending that in your situation where you can't do the surgery, and see if with the alpha stem we couldn't improve the condition of the eyes that way. Yeah, those would be kind of the areas I'd go to. Yeah, and when you say you're not sure if the NSAIDs and the gabapentin are helping, there's not a barometer to be able to tell, other than if you were doing something else and you could see that the dog's attitude improved, their mobility in the house, maybe less sleeping because there's less headaches, then they would be perking up. And so then that's going to be your best indicator. Of course, when they're older, depending on how old, if they don't hear so good anymore, then sometimes they sleep more because they don't hear and things like that. I also, on that gabapentin, too high of a dose can make them ataxic and makes them sleep more. So you want to be careful that you're not overdosing on the gabapentin, because that can take an individual that without the compound, without the drug, they'd be active in the house. And with the drug, they're just like a zombie. So if you don't think it's helping, that may be one to wean off of and then see if you get more life back. Alrighty, thanks for that. Hopefully some of those things will help. Is it safe to wean a 15-year-old dog off carprofen for osteoarthritis and replace with natural approaches? Yes, it definitely is safe. Now, that depends on what definition of safe you're looking for. You can wean them off, and that's no problem. And actually, if you're on NSAIDs, you don't want to stay on the same one for a long time. And you may even, if you're wanting to switch off the carprofen, look at the Galliprant, because it's not an NSAID, it's an anti-inflammatory, and that may be help. But I would bring on the other natural approaches first. Also doing some things topically on the bad joints and making sure that the chiropractic adjustments are being done, and then start to wean off the carprofen. At least without the NSAID, you got a better chance of sparing the kidneys and the liver longer. So that's what's going to happen at the 15-year-old. If they haven't already had cancer, and you can say, well, we've got over that hump, then you're more likely at that age going to be looking at some kind of renal insufficiency, chronic kidney disease that starts on them. So, or just the fact that with the bad arthritis, if they're a large sized dog and they can't get up and move around, then you're faced with having to do the inevitable just because their life is miserable and you can't mobilize them. The other thing too is I would, depending on the size, if you are trying to get them out walking, is getting a harness that fits right properly, so that you can take some of the weight off the legs, and then they'll be able to walk further and their muscles will get stronger. We gotta deal with gravity the best ways we can. So there's lots of really supportive harnesses, covers the body and down the belly, and you pick them up like a little suitcase. And then also we had what we call giddy ups, which are little loops that we just put around the back legs while you're with them. They're like a little marionette, and you can move them around and help them to navigate, especially for those that have the paresis in the rear from back problems and things like that. But anything that's making that rear end weaker, if you can take a little bit of the load off, then it helps them to use their soft tissue, the muscles, better, and then they do get stronger. And they're not falling. Some of them quit trying to get up and walk because they fall so much. It's just like, Well, phooey on that. I'm not even going to try anymore. So those are things that you can do to help them feel better about themselves, reduce the pain impact on the joints because of gravity, and then get them navigating so they can go back out and do those walks. Even though it may not be as long of a walk, but they can get outside and go a little ways and they feel pretty important that day. Okay, good. Thanks. Christine has a question about Dr. Katie's herb garden. Okay, she mentioned 4 specific herbs: calendula, yes, helichrysum, chamomile, and rose. Are there any other good ones I should add? So, yes, some of those can be eaten. Some can go like you can like they dry up and you can make a tea, and then you put the tea in their food. So that's another way you can do it. Other herbs that are good. Hey, you can grow dandelions. And make them. Poor dandelions. I've seen some really pretty ones. The people are out there just destroying them. They're killing them off. Of course, you don't. They have a whole yard of dandelions. The neighbors, I'm sure, would talk. But I've even been in fancy restaurants. I'm looking in my salad. I'm going, oh yeah, we got some dandelion leaves in here. So dandelion leaves and root. So leaves is for the kidney, the roots for the liver. So you can plant some dandelions in your little garden, and that would be helpful. It kind of depends on if you're like what else you're wanting to do. Like if you're wanting to address GI problems, a calendula is really good for that. Cardamom is also another one that's good for GI, so it helps in that way. Dill, so you could plant that. Yeah, those are some other ones I can think of other than getting into the real specific ones like, well, some of them you can't grow here because what you're talking about is doing a small garden at your house or a box garden of herbs. So, well, I guess roses or bushes. Yeah, there's all kinds of things out there that can be really fun. So yeah, so they can eat the dried, you can crumble it up in with their food. You can use the dried to make a tea and then use the liquid. Just depends on which ones that you have. You could turn it into a powder and add a little bit. Good. Well, that was a fun one. The question says, do I have an opinion regarding the effectiveness of red light therapy for pain in dogs? Oh, yes, I have a big opinion on that. I have several presentations. I know I talked about it some in the pain program. I'll talk about it some more, and I've talked about it a lot. I think that red lights and the low level light therapy, the near and the far infrared light therapies, yes, they're all very effective. In our Senior Dog Summit, we had just a whole presentation on laser. So it's a good way to go. Now, the laser on your little pointer thing, pin, that's not going to do it. You have to have something that has more diodes and has different frequencies going through that. The companies whose products I utilize for several different reasons is Revitavet.com. And so they have ones for horses, ones for small animals, and then a lot of them then us humans use on ourselves. So I'm just to give you an example here. I've got one of just the red light pads, and every now and then I'll get cramps in my legs at nighttime. For my calcium, magnesium didn't take enough, maybe didn't drink enough water that day, wore some different shoes, walked differently, whatever it is. My feet got cold and legs got crampy. But at any rate, I have that laser pad thing sitting there by the bed, and once I get the cramp to where I can actually get up and do something, I'll grab that pad and put it around the legs where the cramps are, and it helps a lot with that. But it helps with, I talked yesterday about the chronic otitis, really bad ear infection dog, and used the low-level laser on those cauliflower ears and just shrunk all that down. I've used a horse with ring bone. It was so bad. The horse was very lame. It was a Palomino horse, and there's like, oh, the traditional vet's like, well, this isn't ever going to get any better. It's only going to get worse. You're just going to have to pasture him. He's now a yard ornament or a pasture ornament. And so they came to see me. In addition to doing chiropractic, we started her on the laser therapy, and within 30 days, I sent it home. I would always, I have the devices that I would lease for them, people to take home and use when they hopefully wouldn't need it forever, but she ended up buying one, and used the diodes around that coronary band where the ring bone was coming. Unbelievable. In 30 days, if I had not known that this was the same owner and the same horse, I would have swore that they'd swapped out horses. Unbelievable how that bone changed there right above the hoof and the coronary band, right? It was amazing. So yes, it can be very effective when the right device is used at the right time frequency. You can't just do it once every 2 weeks. You have to do it more often. You got to get the ball rolling, get the changes, get the cells, get the clasts and the blasts and the breaking down cells, the building up cells, all of that going. So that's my opinion. Thanks for asking. Debbie has a 12-year-old cat diagnosed with asthma. It's been given some Depomedrol. Okay. So that worked for a little while and then needed in 3 months another. Oh, I see, but it only lasts about 10 days. Yeah. So, alrighty. So this asthma thing is pretty interesting. I mean, you want to try to get at what is the underlying reason for the asthma. Is it molds? Is it fungi? Is it a change in the continuity of the cells of the epithelial tissue inside the lungs? Yeah, so in order to handle it, so the Depomedrol is just taking down the inflammation that's then causing reactions. And what's going to happen is that if you keep doing that, you're going to end up with a diabetic cat. So it's not a good exchange, but to put out the fire for an emergency, it's what you have to do. But over the long haul, you want to change that out. And there are different herbs and homeopaths that can work like steroids that aren't steroids. And there are also a lot of herbs for asthma. You can look at doing some things with the diffuser and putting some, there's like doTERRA has one called Breathe. There's different essential oils blends that are for breathing that you can put in a diffuser and then have that run. So you can talk to Dr. Janet Rourke and then find out what her recommendation is on the essential oil in that perspective. But I use Breathe around myself every night and the dog and the cat, and it's fine. The other thing would be, I had some thoughts going here on the asthma. So that, I hate that. Essential oils, different herbs, products that would be like steroids that aren't. I'll have to see if I can think of what the other thing I was going to mention about that with the asthma. Oh, I know what it was. This is where doing biofrequency analysis comes in. I was talking about trying to find out, like if it's a fungus or a mold, you want to get the mold situation handled. Maybe the ducks in the house need to be cleaned out. Maybe it's a seasonal kind of thing and there's something out there blooming or the mold counts up and that kind of thing. So doing biofrequency analysis or somebody that does AK can kind of work through exactly what's setting it off. So Oberon is a system that is easy to use at home. It's designed more for the individual. But within that system, when you scan, it will actually show up like the lung field. You would see how bad, based on the frequencies, how bad this tissue is compared to what it's supposed to be. And it'll break down. Is it the bronchi? Is it the bronchus? Is it the trachea? Is it the pulmonary field? What area of the pulmonary tissue? And then what's causing the problem? So then you can go after what is exactly causing the problem. And within the system, you can do the treatment. So it does rife treatments then through that tissue to help with that. And you can see each day then as the numbers change and they get better and better because it's treating the tissue, it diagnoses and it does the treatments. So that would be, and that's an easy thing to do. And also with those systems, you can make tinctures. So like say if there were certain plants that were causing the problem, well then in a a bottle of water with a few drops of grain alcohol, you scan the item. So if it's, I don't know, whatever, a fungi, a mold, certain kinds of plants, and then you put those frequencies, so now it becomes like a homeopathic preparation into that liquid, and then you concuss it, and then you would do 3 or 4 or 5 or 6 or whatever drops of that. Usually with the cat, you're around 2 or 3 drops twice a day, maybe 3 times a day initially. So you're actually treating your cat for the exact same thing that is causing the problem, but a mirror image, and so it flatlines. And then it's like doing allergy injections, only it's with liquid drops specifically then for your cat. So that was another thing I was thinking with the cat, that would be really good. That would be something that I would do for my clients because I have in the system. But that would be another thing for you to look at. Thank you. All right, a 10-year-old Labrador with really high blood pressure. So he's on benazepril to reduce the blood pressure. So and that's one of those things, putting out the fire, but what's causing the fire? So that's where you got to look. So the blood pressure, what is putting the pressure on the heart or on the kidneys? So the kidneys can have excess pressure, which is going to go then to the heart. Liver can back up. So a kidney that backs up puts pressure on the left side of the heart, and the liver that's backing up, congestion, is putting pressure on the right side of the heart. A Labrador tends to be a kapha kind of a dog, sometimes a little bit pitta, but from the Ayurveda perspective. So again, this is another one that is going to tend to be retaining fluid. So too much fluid can build up pressure. So you want to look at those things. So look at the lymphatics, look at kidney, look at liver. There's herbs for those systems to help in improving their function. And then lymphatic flow. This is another one where I'd have this dog I'd be doing the biofrequency assessment with and finding out what's really causing the blood pressure issue. And then go after treating that, because if you treat that, then the pressure will go down. So, yeah, while the blood pressure, people tend to think, oh, it's a heart problem, it certainly can be something prior to the heart that's then leading to the high blood pressure. So, those are some thoughts on that. As far as an herbal that can help with blood pressure, and that is hawthornberry is good with helping with blood pressure, and there's other ones too. You can go to that Banyan Botanicals website and plug in blood pressure, plug in different words like that, kapha. You can look at the different ones that would then help. And again, you're back to having a powder you can make a tea with, and then add it to the liquid, stir it in the food. My dog's on a couple of them. So there may be some things there that would work well for you too. And then lymphatic massages, things like that. Alrighty, very good. Get another one on the way. 18-year-old Pekingese rescue came with eye ulcers, so probably has that keratitis sicca, the dry eye. Of course, they got the big round eyes, and so sometimes the eyelids don't really cover over them as good as they need to. All right, so you've got some eye things, and okay, get some gel and some drops. With drops, are these still painful? Do you mean, are the drops painful? Sometimes, okay. The ulcer should be healing unless it's that the eye is dry. And so you're putting in liquid tears, you're putting in tears. Sometimes some of those you have to put in tears, like you might do the medicine in the morning and the evening, and then a couple other times during the day, you put in some just artificial tears. You may have to do it 4 times a day. Once ulcers heal, they're not painful. Now there may be scar, or sometimes I've seen the Pekingese where they get the pannus, where you get the dark, the black that comes around, the pigmentation, and they only have a little space, kind of like having a blinders on. So they may not be able to see so well if the pannus is really thick, but it doesn't necessarily mean that it's painful anymore. Only when the ulcer is there, the crater, is it a problem. And is there anything more you would suggest I do? The ulcer should heal. So if they're not healing, then I would expect that you've had the eye tear levels checked, and that you would also want to know, is there any glaucoma? So those kinds of things. And then other drops, anything else you would suggest to do? It's one of those where I'd have to see them and know what was the real reason and how much is going on. You're certainly not going to put laser across the eyes, so you're not going to use those on the eyes. You can do the alpha stim around the eyes, though, which will help. It'll stop the pain and help anything to heal. So that would be an option for you there. There might be a homeopathic. You might want to talk to Dr. DeBlanco and see if there's a homeopathic something that she would work through for that kind of thing. That would be my other suggestion. And then there's the essential oils that you can use, like some frankincense helps with pain like that. So that's an option there. That is boswellia. The copaiba is another one. So some of the essential oils for pain, you might consider those. It would help with that too. Thank you. All right. So it looks for right now, we don't have any other questions in the box. A lot of them today have been on some other topics, but that's okay too. If you got something else that I can help you with, anything for those seniors to get them feeling more comfortable, we want to do that. We've been through teeth, we've been through ears, talked about joints. What else can we talk about? My dog's standing here now. So she came in to see, oh, there you can see her tail wagging. She came in to see what's up. All right. Let's see what we can come up with to fill in a blank. I guess I can talk a little bit about the mental stress thing until we get another question. So there are drug compounds that are available to take stress off of, like to help somebody chill. However, it's not most of the times the stress that's coming into them, there are environmental situations that need to be addressed on how that individual perceives them. And their perception of what's happening can certainly be altered based on what their life has been and what their endocrine system's functional level is. So if the adrenal glands are always in a hyper mode, which is going to be sympathetic dominant, then that individual is going to tend to always take things to the extreme. They're always going to look at something like it's worse, it's terrible, as opposed to saying, okay, I can handle this. They don't feel like they can handle anything. And part of so now we have adrenal glands that are ramped up. When the adrenal glands are ramped up, then they're going to start producing inflammatory hormones that are going to then start causing issues in other areas of the body. And then I talked a little bit about this one of the nights too, but in order for those adrenal glands to be able to be calm and to take this 911 push of the flight or fight situation, so you can have the one that wants to run away and hide, or the one that wants to attack, this is going to be exaggerated in a situation where their body calcium and magnesium levels are low. So one of the first couple things that you need to do then is to address their specific mineral level. And certainly I do it with the hair tissue mineral analysis test, but I mean, if you just want to hedge on the fact that if they're sympathetic dominant, if they're that fearful, you need to get some calcium and magnesium into them. And so there are just specific calcium magnesium products that are usually balanced in a 2.5 to 1 ratio. But there are situations where you actually need more magnesium than calcium in individuals. So you have to play with those two. And then there's different forms that work in different body pH scenarios. But also, generally, in a sympathetic state, we're going to be a little bit more acidic as opposed to alkaline, which is the parasympathetic state. So you would look at calcium forms that are going to work more in acidic. So that would be not using an ammonium form or not using the lactates. Those are more in that alkaline. So citrates would work fine, and the other chelated calciums, chelated magnesiums, that type. So start with that and just work on getting these calming minerals into them to help take out that fear factor. And then their whole mental state will be better. And then there's lots of different essential oils to help them be calm, things that you can use before you travel. I have a herbal liquid blend called Frick's Calming Tonic, and it has valerian, skullcap, eleuthero, and St. John's wort in it. They're in equal proportions. And so this we use a lot of times for like when they don't want to ride in the car, when you're getting ready to go on vacation and they're already getting nervous because they know they're going to go be boarded someplace. So it's an herbal blend that you can use as opposed to jumping on the wagon with the drugs right away. Alrighty, so we've got a couple questions here. I'll get one of them up and then we'll go from there. Non-surgical strategy to decrease or remove meibomial gland cysts. That's a hard one because, again, those are at the eyes. And so you have to have something that's not going to harm the eye when you go into the eye. That's a tough one. I've done surgery on those where we just cauterized them. We didn't like remove a whole big section or wedge of the eyelid. I went in with a really, really small cautery, like a wire into the middle of them and just cauterized them. And then, they burnt and then they went away. So depending on what the surgical strategy is that they're talking about, but that's a hard one to do just because of the eyes. You can't, there's so many things you could do somewhere else that you can't use there. So I'm not much of a help on that one. Maybe some of the other presenters would have an idea, but that is, if they were really bad, that's what I did, was the cautery wire. All right, so yeah, sorry about that. A cat with a differential diagnosis. We talked about asthma versus heart disease. The x-rays are inconclusive. So I would do the same thing I was talking about before. You need to find out what's the underlying problem. I would do the hair tissue mineral analysis to know what's causing it. I would also do biofrequency analysis because it can get in there and find weirdo things that you may not otherwise think of. I mean, maybe it's some kind of a bizarre parasite that's gotten into the cat, that's migrated, and now it's kind of set up camp, and then it's creating this inflammatory cascade there in that tissue. And I'm sure that the ones with the asthma that you've tested them for heartworms and it's not that, but that doesn't mean it can't be something else that's gotten into the cat that shouldn't be in a cat. Like maybe it's a parasite that belongs in a fish or a bird and it somehow has gotten into the cat and it'll never become the adult, and you're not going to be able to find it in a regular test, but the biofrequency can ferret those out. Yeah, there's I can see, I know from a traditional perspective, they're using compounds and drugs to try to stop the reactions, but you haven't figured out why it's happening. And that's how I go after it, is finding the why. Coughs, a lot of times when the coughs are really bad, I might use some hydrocodone for a little while because it can be so debilitating, the cough, and then that goes on, and then the chests get painful. So I've seen I remember this one that came in that was having all kinds of respiratory problems, and it ended up being some really bad subluxated ribs and thoracic vertebra. And once we got those things handled, the whole breathing situation improved and the problem started resolving to the point that it was easy to handle and then went away. So it's looking deeper and beyond. And so this is where the holistic practitioners The ones that do kinesiology, the ones that do biofrequency analysis can help you get into some of those other weird whys and then find the real solution. Because if you can pull the peg to the kingpin, then everything else will go away. Otherwise, we're just guessing and continuing to throw more medication at them, saying, well, maybe this will work. Well, maybe this will work. And it's really working through the chain of command of that problem to get to who started it. And then it'll all dissipate. You got another one there for me? Alrighty, loving the kitty questions. I have a 9-year-old cat rescued with a broken spine. So are you saying the spine's broken in the middle like it was hit by a car, or is it down lower in the back? Help the colon to function better. Oh, I see. She's paralyzed from the middle of the spine. Oh, she can't move her legs at all. Oh, what a bummer. Okay. So now what you're looking at is the potential that there's some nerve deficits still from that area. Okay. So I had this dog that came to me when he was 10 years old. He was a cardigan corgi, and he had injured his spine when he was 5. And for 5 years, all he did was drag himself around. He could get up for a step or two, but other than that, his legs really didn't function. Now, he did have some, like if you pinched him really hard, he did have some withdrawal reflexes because he could do a little bit. I don't know how far into it she is. But with that dog, I did some of my nutrient protocols. This is before I was really, really, really doing the hair tissue mineral analysis. So we did alpha stim on that dog through the spine, through the injury, through the back legs. We did the whole spinal protocol, started him on the different supplements, a couple herbs. He got that therapy every day, actually twice a day, and then put him in the underwater treadmill. And within 3 months, that dog was walking. Obviously, he walked before the 3 months. He eventually got to where he could do 3 or 4 stairs. It wasn't real pretty, but he could get down the stairs and up the stairs. He chased the kids playing football. He lived to be 17 years old for a cardigan corgi. Half of his life, he'd been paralyzed. He was 10 years old when we started therapy, and he was resolved. So there are things that you can do from that perspective. It's about if there's anything left with those nerves that we can improve the myelin, improve the ATP production, improve the endings of the nerves, trying to get that train to move all the way to the end of the track, rebuilding track so that the train has somewhere to travel. All of that I would look at. And you can use the alpha stim to treat through the abdomen. You could do some laser on that area too to help, but I'm just telling you my protocols and what I do. So that's where I'd go to. Obviously, with this one, you're not going to be probably doing chiropractic in that area where the injury was, but you can definitely adjust them before it and below it. So I would do some of that. I would be doing different exercises with the legs, trying to get some, you can do that range of motion like the bicycles, and that helps keep fluid going, but you want to get some where you're starting to get some muscle pressure, muscle tone. So there'd be some other specific exercises to try to do. And then I'm wondering if you have systems set up like harnesses, slings, things that you can do to get her up off the ground where her legs can dangle. And you could, if you had something like that, you could even then put her in the tub where you're kind of holding her up, but you're getting those legs down, because too many times they're in flexed positions all the time. And so then you get in the front's carpal flexion. So you get flexion that becomes chronic, and those tendons become very shortened, and then they can't even extend their toes, so they can't even stand up when it's been this way for a long time. So there's exercises to actually get those toes to stretch out again that you do. So there's a lot of different things from that. Now, in regards to helping the function of the colon, Dr. Blanco in her program talked about Nux vomica being used. So you can go back to her program for those ones that have the constipation. So it's about helping motility, helping movement. So that would be the other thing that I would look at, listen to her program and get her protocols for that. And I would then add that into the program as well. But part of that is part of it's because of the nerve injury, and part of it's because she's not really moving anything else either. So a lot of circulation, massage, and then other things of motion to the rear. And hopefully she's a nice kitty and she'll let you do some of that and doesn't just protest from the very beginning. All right, another question. We've got a few minutes here. All right, suggestions on whether or not to vaccinate a 9-month-old healthy rescue cat that has not had any yet. Will always be indoors, but concerned about exposure to things outside on a harness. Well, the answer is going to be that if you keep that individual cat's immune system up, you should be fine in going outdoors. So quality food, quality immune system, and even just walking. Generally those viruses, if you're not letting the cat drink out of a bowl that a lot of, like you set out food and water for strays that come around, and then the cat sits out there and goes and drinks out of the dish where they were, you're saying that he's going to be on a harness. So it's mostly just going to be strolling and sniffing. It's not going to be like getting into food and water where something might be. So I would, for more information on that, you really want to get more scoop, is to go to Dr. Will Faulkner's website, vitalanimal.com, and he has a whole course and he has a lot of information on that. And he also talks about using NSAIDs to help build that immunity. So you don't have to vaccinate them. You can do the NSAID program. And Dr. Blanco may also have some information for you. We didn't talk about that because that's not what this program was, but in some of her other programs about NSAIDs as a way to vaccinate. So I would defer to both of those homeopathic practitioners on using the NSAIDs. But nah, I wouldn't vaccinate. I wouldn't put any virus into the body that's not already there. Thanks, Holly. Alrighty, so one more. Yay, okay. How to know if my dog is in pain when she doesn't show it? She has dementia, walks in circles, and her rear legs don't hold her up very well, and she's totally deaf. Well, so pain would be if she's not eating. We could consider that there could be more pain. Pain could be if she goes to moaning, because there could be a time where she would start moaning as a way to help with the pain. There's actually that frequency, like the hum, that low, that can actually help sedate pain in the body. So sometimes moaning will come in when there's pain. So there's that. If you watch Dr. Edwards' program at the beginning about silent pain, you learn how to touch them in ways. This one was on cats, but he has other programs too with the dogs that you can feel and tell is their body stiff and sore. So if there's, so just how you touch, because there'll be reactions that doesn't have to come from the mind. So the dementia part, the body will still show you that there's pain in those areas. I'm suspecting if she walks in circles, she probably tends to go one direction. So she's going to get more rounded one way. So I would, even for her in that situation, I would still take her to the chiropractor and have her get adjusted, because she's going to tend to get curvature in one direction, usually when they're like that and they walk in circles, it's like that. And there are some different herbs and things that can help with helping to settle some of that dementia. So you could even look at that, different pheromones that can help a little bit. But I would just err on the side of caution and do things that would be beneficial. And if she's not screaming in pain and doesn't try to bite you when you go to touch her, sometimes you have to warn them that you're going to be there, because if they don't hear and you come up on them, then they can jump. And so then that would scare them. And so they might bite out because they didn't know. All right, well, we are at the end of our day 4. We're at the end of our questions and answers for today's Pet Pain Relief Summit. Thank you all for being a part of this. We've thoroughly enjoyed it. I know the other presenters enjoyed giving their programs. They all had fun. And we appreciate the comments we've been getting, that it is valuable to you, because that's why we're doing this. Thank you again to our sponsors, PolyPets, Turmeric Life, and Yum Wolf, for helping to make this summit possible. And then for the crew at Pet Summits and all they do. Thank you all again for being a part, for sharing some of your days and evenings and wanting to know what else is out there to create a better life for the pets that you love. So thank you again, and I hope to see some of you in that post-summit course. So I say for now, adios and happy trails.